Hi, so this is Debbie Johnson from Pilates in Bridgewater, and this is a pelvic floor basics video. Normally I run the pelvic floor sessions and they're quite closed because it's quite an intimate thing and I want people to be able to say what they're feeling and all this sort of thing. But this is a little clip for people who do find pelvic floor dysfunction. So that can be virtually anything, and it's also men, because when you get older you prostrate, or you may have had some surgery or something like that, and we've all got the same slings of muscle in our pelvis, and it contributes to our core stability. It's actually the bottom of our core muscles. So we have diaphragms at the top, we have the pelvic floor at the bottom, we've got the obliques at the side, muscles in your abdomen at the front, muscles in the back. I won't go into specifics, but it's almost like a little box. So if you don't have the bottom of the box and you squeeze the sides and you bring the diaphragm down with your breath, obviously what happens is the pelvic floor pushes out and there's no contraction through your abdominals. So it's got quite a big effect on your stability of your body. And also if you've had things like any bits taken out, hysterectomy or something like that, everything in that box is then a little bit looser, because where it's tightly packed, things are quite solid, but when you take something out, the box is a little bit more movable. So we need to pay attention to the pelvic floor. Now the easiest way of learning your pelvic floor is to lay on your back, and I've got sort of various functions that I use: east to west, north to south, the Hoover and all these sorts of things. So if you want to find out more about that, then give me a call. But I don't think that's necessarily the good way to actually use your pelvic floor, because what you want is to be able to walk around, move easily, comfortable and confident in the knowledge that your pelvic floor is going to work. Because the pelvic floor is the size of my hands, so as you move it's going to stretch in different directions, and there's no point if there is movement without strength and stretching. So we're going to do some all fours work today. And the main thing is that your breath is important, because with your breath, as you breathe out, the Pilates breath, you're going to feel this sort of contraction, and that's what you want to keep at a very low level. These muscles aren't designed to work at a high level, and I would say 90%, 80% people are overworking these muscles. And of course, once you start to get an issue, you work them harder, and that has the opposite effect, because when you work them harder, they start to give up, because there's just too much for them. They're designed to work all day at a low level. They're not designed to work all day at a high level. So once you get that in your head, you just need to understand the engagement, the correct method of engaging those muscles, and things will work for you. So what I'm going to do is just a little bit of an all fours session for people today. Again, I like to be able to do the pelvic floor. I like to make sure people get the fundamentals. Then I like to do it squatting, I like to do it standing, one leg on a chair, one leg up in the air, anything else, because that is daily life. Unless you're going to walk around with your legs together and not move, people aren't going to have the functional strength there and the knowledge of how to do this. And it is guys as well as girls. You know, there's, unfortunately on the NHF they don't do a lot of support for guys, but fortunately I know of people who do. So we're going to start on all fours. We're just going to start mobilising the back. The hands and wrists are underneath the shoulders, knees are underneath the hips, and we're just gently moving backwards and forwards to get those wrists a little bit more mobile, a bit more warmed up, activated if you like, so that they're going to take our weight. And if you have trouble with all fours, there are loads of options. I've just selected this one for you today. So we're going to start now to bring the body back up onto all fours, and I'm going to start to lift the abdominals up, stretching the back, and then bringing the head away from the tailbone as much as I can. Then I lift up again, I hope you can see with my t-shirt on, and then extend away. So I'm keeping those shoulders back and down. I'm tucking the tailbone under, but I'm really just connecting with my pelvic floor. Now we're going to do this with the breath. As I said, that's important. Take a deep breath in through the nose, and as you exhale, let the breath come out through the mouth and feel your stomach pushing up into your spine. Inhale again. So there's lots of different movements. Exhale, as the body has different movements in life. It's important to get a range of movements connecting with your pelvic floor. Now we're going to take a deep breath in, and we're going to stay connected by just drawing up your pelvic floor. So imagine you're going to pass wind or water. Men, ladies, exactly the same. My cat's in disgrace. Take a deep breath in and exhale, looking over your right shoulder at that right hip. And then come back to the center. We'll high arch again, in breath and exhale. So when you do pelvic floor work, it's a good thing to do it nice and slow and concentrated. Take a deep breath in. Exhale, let's look over the other shoulder, and you're bringing the hip around. So I'm getting a stretch on this side as my hip gets closer to my shoulder on the other side. I take a deep breath in and I high arch again. Exhaling and then inhaling again. Now to make that a little bit more, I keep my shoulders away from my ears so my abdomen is working. I'm picking my foot up off the floor. I hope you can see. Taking a deep breath in, I'm now swinging that foot over, keeping the knee on the floor and exhaling in as I do that, and still maintaining my pelvic floor connection. Come back to the center and lower down. And again, everything needs to be definite with your breath. Inhale, expand your rib cage, and exhale as we take the foot across and look over that shoulder. Inhale as we come back to the center, and let's get some movement here. So this is more functional movement. The abdomen is still connected, so when you pull up your pelvic floor, your abdomen will engage in most people, but not in everybody. So take a deep breath in. We're going to rotate now, hand to the shoulder, push into the hand that's on the floor, and lift and open your body, but still with focus on your pelvic floor. And then bring that hand back down again. Inhale and exhale as we're lifting. Still keep that connection. If you can't speak and breathe, you can't move with function. And again, if you want to now, we can take the arm up and lengthen it a little bit more. And bring that arm all the way across, letting the shoulder go down. And again, the pelvic floor is really stretching. So I'm getting some movement in there. Take a deep breath in, exhale. And any kind of effort is going to exert that downward push into the pelvic floor. Dig your toes into the floor. Inhale and exhale, lift your legs up. And we're just going to start walking one leg and the other. So again, this is a familiar position for lots of people, but the main focus on pelvic floor work is that you are focusing on keeping that connected pelvic floor. And at first, this is a conscious movement, but it will become an unconscious movement. Let's take those feet down again. And we're going to take a breath in. We're going to put the other hand up here. And we exhale as we open the body out. And of course, what's happening to the pelvic floor is it's stretching as I'm moving to the side. And inhaling as I'm coming back again. And again, exhaling as I'm stretching up. And inhaling as I come back again. Now I'm going to take a long arm as I stretch up. And I've got even more movement, rotational movement, get your tail out of the way, as I come down. So now here I've got a little bit of a twist, so my pelvic floor is being squeezed and turned. And I still have to maintain that connection as I'm doing this. Take a deep breath in. So if you want to work on the specific muscles with me, give me a message and I will do a little workshop. Take a deep breath in, we'll lift up again. And we'll walk through the legs. Okay. And then lower the body down. And you may want to just sit back on your haunches, get a stretch through your back and also through your wrists. That's entirely up to you. And we'll go the other way. I'm going to stay on all fours though. But if you want, and I say more, I don't publicise all the pelvic floor things here, because they're quite some quite intimate details. Shoulders slide back and down. And now I want you to bring your hands down like this. So you're going to feel that there is a little bit of abdominal work going on here. and there'll be that activation. Now imagine you're going to pass wind again. I know this is a very strange way of looking at things. I can't think of a better explanation. So just draw up your bottom and your front passage so both are interconnected. And we take a breath in and we exhale as we take our bodies forward like a sleeping lion, drinking lion. Inhale, bring your body back, and you're going to find the rib cage is anchored here, but that means then that the whole of the body can stay connected. We'll take a deep breath in again and exhale as we go forward, and inhale as we come back again. So the movement is very, very small and very focused because we're retraining the body and getting the mind to accept what it's got to do. And quite often when you're in your daily life, you're doing other Pilates moves, there's so many things to think about. But with the pelvic floor classes, they are very focused on the pelvic floor. So you should have felt that here you understand a bit more about the rib cage staying stationary. We're going to now stretch the pelvic floor even more. I'm going to sort of open it out a little bit more. So relax those shoulders and take a deep breath in. And all I'm going to do is keep my body weight centered so I've got core stability, lifting the leg up and lifting the leg down. Now for anybody who finds a problem with pelvic floor, opening the legs is an issue. But of course you need to do this in daily life. So this is something you need to practice. Stay in control, just stay connected with your pelvic floor. Imagine you're passing wind, so you're just holding it together and coming down. We'll do one more. Inhale and exhale. And then we're going to come up and we're going to take a big step forward on that same leg. So what I did then was open my pelvic floor stretched that way. Now my pelvic floor is stretching this way. So lifting that chest upwards and just moving the hip, making sure this knee doesn't go over the toe, and then come back. So again, just maintaining that connection and really focus on that part of your body as opposed to anything else that's going on. So later on, when you're experienced, I bring in lots of other things to challenge your mental, your ability to stay connected with the pelvic floor. But when we start off, it's always very basic because it's quite hard to think about stopping yourself farting really, or passing wind. So you really got to just stay focused on that. And then we're going to go back down on all fours. And now we're going to circle the leg. So of course this is moving the pelvis in a different pelvic floor in a different way. Shoulders are relaxed. Take a breath in and we circle the leg 3 times in one direction. And now 3 times in the other direction, still maintaining that connection in the pelvic floor. Still maintaining that connection in the pelvic floor. And again, guys, girls, don't be embarrassed. You know, lots of people have this. They say 1 in 3, 1 in 5 people have this. Now I'm going to turn around so we go on the other side so you can see. My cat is in the way. I think she's stuck to the mat this morning. She's been naughty, so she's... We're on all fours in this position. Okay, so we started, if you remember, shoulders back and down, and my t-shirt is hanging, but really, as I'm drawing up my pelvic floor, it automatically encourages my abdominals to engage. Taking a deep breath in. Keep the weight dead center, because if your weight moves over to one side or the other, you've lost the test to your core stability. And we're just lifting the hip, exhaling, inhaling out, staying with that connection. Exhaling, inhaling as we come down, and exhaling. You may not lift your leg very far if you're staying focused with that central part, and again lift up and back down. So remembering that the pelvic floor runs from your back passage to your front passage, so it's quite a, you know, it's quite a long area, but it's this big. It's quite a big area. So taking a deep breath in, we're taking the hip forward, and we take the hip backwards. And again, just getting used to movement but staying focused on connecting with that pelvic floor. So we're just allowing the body to find that connection as you move. Take a breath in and breathe out. Now, if you're engaging your core correctly, you will find that you can still breathe and you can still talk. When people take a breath in and all the breath is in the shoulders, that's quite difficult to do, so you don't have that pelvic floor connection. Then we take the foot back, and we're going to try those circles again now, taking a deep breath in. Exhale, circle 1. Inhale on the way back. Exhale, circle 2. Inhale on the way back. Exhale, circle 3. Inhale on the way back. Let's go in the other direction. Exhale, inhale down. Exhale, inhale down. And exhale, inhale down. Take those feet down. Give yourself a nice relax again. And just moving those wrists, So that was kind of a little bit of a taster today. And I try and do, I say, all different positions and different actions, so we're actually mimicking the daily life of your daily life. You want to be able to control your pelvic floor all the time, but the pelvic floor sessions are very focused on that as opposed to anything else. So I hope you've enjoyed that. Have a good day. If you want to find out more, of course, just message me, and I will probably run a masterclass for you all. So just enjoy that, everybody. Have a great time. Bye bye.